Hi and welcome to Schein Chats. I'm Vikki Goodall, the Sales and Marketing Director for Schein UK, and today I am joined by Sara, the Chief Dental Officer for England. We're at the BDIA Showcase today and we're going to talk about the future of oral health in England. So, Sara, thank you for joining us. You've just come off the main stage doing your first briefing of the day, which I saw, which was excellent. Can you summarise what the long-term plans are for the NHS England?
Well, the NHS long-term plan was published in January of this year and contained a whole different approach. It's putting the patient at the heart of what we do, but it also talks about collaboration. NHS England used to have almost sort of competing silos of care. What we're doing now is putting oral health as an ability to enhance outcomes for a patient with diabetes, improving outcomes for people living in care homes, improving outcomes for children that have learning difficulties and autism, and where oral health can play its part in that. And as a result of the long-term plan, oral health is no longer thought about as dentistry. It is thought about how we can deliver care, not just in the services that are provided that we traditionally do, but how we can augment that care. And we're thinking differently about the dental team, working in partnership with primary care networks, with community pharmacies, going into care homes, and we don't mean just doing domiciliary care. Okay. This is about how do we enable a care home worker to be able to make sure that the daily care for someone in a care home is done well. We're also making the connections with the sort of what we call the non-communicable diseases, the cardiovascular disease, the diabetes. And for me, I get back, and I know I've used the phrase so many times, but we are absolutely putting the mouth back in the body, and we're putting the oral health messaging and the practices into every care pathway, with the dental team delivering their part of holistic care. And that is a nutshell. There are clearly many other things within the long-term plan, but I would say the takeaway for the dental profession, the healthcare profession, and the dental industry is that dental care and oral health remains a commitment within the NHS and is absolutely there, enshrined in the NHS plan, with, from my point of view, a fantastic endorsement of the work we've been doing on starting well and child oral health, to which I know Schein has been one of our greatest collaborators.
Thank you. So you talked a little bit about there, and we talk about it a lot in England, but also globally, about putting the mouth back in the body. Why is that integration into general healthcare so important?
Well, I think for many of the practitioners out there, they share my frustration that patients who might seek care from a community pharmacist, might from a consultant in cardiovascular disease, there is no connection with their oral health. I look at conditions such as head and neck oncology, where a patient can have extraordinary amounts of work and surgery done, but nobody thinks about the dental aspect of it. So again, we need more people thinking about where oral health sits. If you do not have the ability to swallow, if you don't have the ability to chew food, if you don't have the ability to comfortably drink because your mouth hurts or you've got no saliva in your mouth, then actually the outcome related to your radiotherapy, your chemotherapy, or your pharmacological support is non-existent. So we need to make sure more people are thinking about oral health. And that for me is why across the world, not just in England, we need to put the mouth back in the body, but the way care is commissioned has siloed dentistry and makes many GPs say, well, I don't do the mouth, go and see the dentist. And a pharmacist will then say, go and see the dentist. When actually, we can change that. And I think that what we did with the community pharmacy campaign this year, 11,500 community pharmacists engaged in oral health conversations, 75,000 individuals across community pharmacies undertaking oral health CPD, having those conversations with patients, and more importantly then linking with the dental care professionals in their own town, on their own high street. And again, putting the mouth back in the body. It's important because the patient, every patient has a mouth. You can't treat the mouth without the body or the body without the mouth.
Absolutely, absolutely. So as us as an industry, Schein, we're part of the dental industry, what can we do to help with these programs?
Well, I think your expertise at messaging, here we are in the BDIA, which is actually a fantastic marketing event. And you look at the slogans, you look at the messages, you know how to tap into the psyche. We need to sell the oral health message to create behaviour change. and actually your expertise in helping us create behaviour changes in GPs, in consultants in oncology, in cardiovascular consultants, in the renal consultants, in the diabetic nurse. We need your expertise. And you are already connected to many of those healthcare workers through a variety of other organisations or your own network. So what I'm looking for is a collaboration, an understanding how we can up our game and market putting the mouth back in the body and create the behaviour changes that you do so well in the rest of your operating sphere. So please come on board.
We're on board. Thank you. And finally, just one last question from me. So, not including the very prominent Brexit, what external factors do you think will affect NHS dentistry in England over the next coming year?
So we've got a number of things that are currently actually mentioned in the Queen's speech. One of the first ones was the change in the non-medical prescribing. So that policy change, the exemptions, to allow people like operating department technicians, pharmacists, paramedics, and more importantly for me, dental therapists and hygienists to prescribe certain medicines. So the ability for a therapist or a hygienist to be able to supply a high content fluoride toothpaste, to be able to prescribe local anaesthesia. That is a fundamental step towards our realisation of the multidisciplinary team to make the patient pathway smooth. So there's one fantastic piece, and that is work that's going forward, and we're at consultation now. That requires the public and the profession to say, yes, this is a great idea. So the human whim and the ability to say yes to a good idea is really important. So that's one of the classic ones. I think the other piece is the NHS People Plan, where we are looking at changing the agenda in terms of making the NHS a best place to work, and how within that plan we use technology to release time to care. We talk about artificial intelligence. I like to talk about augmented intelligence, using technology to do the things that actually take me away from the face-to-face patient interaction, using technology to do things in the background while I interact and create the change, the agreement, developing the patient care pathway with the patient. Those are the things. So technology.
Absolutely.
And human factors. Many of the human factors, like Brexit, none of us are sure where it's going at the moment. But what we do know is that we have processes and planning to think about every contingency. So we have contingency in plan for Brexit. We have contingency in plan for the policy decisions, and we have contingency in plan. We don't just produce one plan A. Always maintain a reserve and always have a plan B. And it's done us well for the last 4.5 years, as I think you've just seen. That's where we go next.
Fantastic, thank you very much. So just to say thank you for Sara for joining us today, and thank you for viewers for joining in. I'll see you at the next Schein Chats.
Thank you.